Okay, what is the TIP Transference Training about? Well, right, it's about transference and trauma. So there's a lot of different kinds of transference. You could be in psychoanalysis for decades and be exploring different kinds of transferences. So transferences are ways that we bring the past and we project them onto the present. In this training, we're only focused on traumatic transference. So traumatic transferences tend to be much simpler, but much more powerful. So that's the focus of the training. The training is for practitioners, so it's for the therapists. Um, so when we're working, so as a therapist, we as therapists are working with clients, we're in relationship with them. Sometimes we can just give them some tools and the relationship isn't that important. But the more relational the trauma is, the more complex the trauma is, then the more we go into relationship and connect with, attune with, resonate with, and deepen a relationship with our client. And countertransference is what the therapist brings to that relationship. So the client has their transferences, ways they're putting the past, especially traumatic events in the past, and they're projecting that onto the therapist. The therapist is doing the same thing. The therapist is taking their past and their experiences and they project them onto the client. What that means is we're one therapist. So I'm one therapist. I see a lot of clients. If I've got pieces of my trauma that I haven't worked through, or if there are habitual roles around stress that I'm not fluid with, that really limits the territory that I can work to my client. I can work with my client. So there's a whole set of subjects where I can't go there because it makes it I'm anxious. And there's a whole bunch of other subjects or areas I can't go to. So upsetting, I dissociate from it. Then there is only this space in the middle where I can come in and work with the clients. They can only join me in a small space. And within that space, if there's certain roles, if there's ways that I need to be in relationship, then that kind of shapes that space, that smaller space. So between kind of roles that we go into in relationship when stress happens, and then our traumatic spikes, I've got a very limited territory that I can work and really invite the client into. And, I can still get a lot of work done. But if I could expand that space and have less distortion in it, then I could be much more of service and go deeper into relationships with clients and more fully.